Of time, we'll start with two questions, and if we have more time, we'll come back around to the top. And we'll begin questions today with Katie Thorson from WXPR in Rhinelander. Katie?
Hi, thank you. Just starting off with, I guess, as people are getting sick, at what point should they be like seeking medical attention or be going to the hospital or things like that?
It's a good question, Katie. I get that asked probably more than any other question I get. Basically, what it comes down to is you have to know the person who is sick, whether it's a child, a parent. Are they at high risk for complications? Do they have diabetes? Do they have asthma? That type of thing. Certainly, you want to get them to the doctor faster than it would normally take for somebody who normal, healthy adult. One thing that people do not think about too often, though, is once they become sick and they start feeling better, and then all of a sudden they start feeling sick again, that could be a secondary infection, usually a bacterial infection, and that would really require to get to the physician, clinician as quickly as possible. Otherwise, it's just knowing the symptoms, knowing the possibility of complications, and making a good, solid choice as to when to see the doctor.
You have another question, Katie?
Yeah, so with the increase in cases, is the state also seeing an increase in hospitalizations right now?
That's correct. They're seeing increased hospitalizations for COVID, RSV, and flu, especially high for COVID and flu. RSV is not quite as high, but it is on a trajectory.
Our next question goes to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for providing this call. Can you give us some sense of scale as to the degree of increases in comparison with past years and typical years?
Yeah, one thing I can say, Eric, is that, with influenza, our positivity rate for influenza tests has more than doubled over the past few weeks. It went from like 3% to 6% to about 14% this past week. So we are definitely seeing an increase. Now, comparing it to other years, it's hard to say. Some years you're going to have an earlier onset, some you'll have a later onset. This is probably what we are normally would be seeing at this particular time of year. We would anticipate, based on the acceleration of the influenza especially, that we're probably about 4 to 5 weeks away from being peak activity, which would be the first part of February, which is typically what we see.
And then follow-up is the same true with the COVID and RSV relative to other years?
Yeah, it definitely is. I mean, RSV itself can either peak before flu, at the same time as flu, or after flu. It looks like it's going to be a peak after the flu season, a later season for RSV, just based on what we see right now, but things can change. But it's not anything, it seems to be a pretty typical year as to what we have seen in the past. Nothing major out of the ordinary at this particular point, but things can change, and we have to be aware of that.
Thank you, Eric. Now to Hope Kerwin from Wisconsin Public Radio. Hope?
Yeah, I was looking at kind of the latest data around influenza vaccines this year, and we've kind of continued to see a decline there. I wonder if you want to talk about kind of this year's number, with it only being 30% of people getting a flu shot, kind of what that means as a state, and how do we encourage increased vaccination?
Now, what you said is very correct, Hope, and it's unfortunate that again, it seems to be another year of decline in our vaccination rates. And it's been on a decline since the beginning of the pandemic back in 2019, 2020. All we can do is keep pushing for people to get vaccinated. The best way to keep the things that are under our control to keep these activity rates down is, number one, as you mentioned, get vaccinated. We feel that the vaccine is going to be effective this year. Our vaccine efficacy statistics should be coming out in about middle of February. But we know we have a lot of vaccine available, and we know it's safe. We just want to get people to encourage them to get it, that this is one of the ways we can control the influenza increases that are going around. Also, we want people to know, practicing good hygiene, coughing into your sleeves, sneezing into a tissue, and washing your hands. Above all, stay home if you don't have to go out and you are sick. We want to keep getting that message across. We're doing everything we possibly can with our public health educators and our communications group to get this message across to people. And we will continue to encourage people to get the vaccine as quickly as possible. It's not too late.
Another question, Hope?
Yeah, I'm curious if, as we see hospitalizations or just, kind of increased activity around these respiratory illnesses, kind of what impact does that have when we're also seeing norovirus in the state and other types of, infectious disease right now?
Yeah, it does have a major impact, and it's been a high increase in norovirus cases this year as well. Why it's corresponding the way it is, we really don't know. But yeah, it could have a lot of impact, especially on the healthcare systems, the hospitals. We are continuing to monitor very closely, the inpatient availability, beds availability. Do hospitals are they running out of space? Do they have to divert to other hospitals? All this could play a fact, but it has been and will continue. It looks like it will continue to be a very bad year with all the respiratory viruses that are going around, in addition to the significant increase in norovirus that we are seeing in Wisconsin and pretty much throughout the country as well.
Thank you, Hope. Now to Drew Best from WBAY TV in Green Bay. Drew?
Thank you. My question kind of goes back to those vaccination rates, and obviously with the decline, is there anything that kind of points as to why there has been a decrease in recent years?
Really, there's not. I mean, we've tried to figure out, as a team, what we could do better. Why are people not accepting the vaccine? Are there too many vaccines out there with the COVID? I don't know. I mean, I don't think so, but we know that vaccines are effective in not only preventing some cases of the virus that it's meant to be targeted, but also, if people do get sick, that the illness will be much less severe and there'll be a quicker recovery. We're just continuing to get that message out. I wish I could point to one particular thing, as to why people are not getting vaccinated, and we could correct that very quickly. But unfortunately, I can't at this particular point.
And another question, Drew?
Yeah, that's what would kind of also go back to the healthcare system. So obviously, with the increase in hospitalizations, it's certainly having an impact on everybody kind of involved. So kind of, I guess, for the next steps, what are the next steps for these hospitals if things continue to get worse?
Well, many of them will start what they call an incident management program, where they have one particular person involved, with any kind of changes that may have to be made at the spur of the moment. That's happened before. It's probably going to happen again. But going into the incident management is a decision made by each and every hospital on their own. We do not mandate that at the Department of Health Services whatsoever. But just trying to keep a track, from my point of view at the Department of Health Services, again, where are we seeing the highest amount of hospitalizations? Where are we low on beds? Trying to get that message across to people, to the hospitals as well. That's just part of a good communications plan. I think we have a very good one to deal with the hospitals and healthcare facilities in Wisconsin.
Thank you, Drew. I saw Sarah Volbetheim from the Milwaukee Journal Sentinel has joined the call. Sarah, did you have a question?
Yeah, sorry if this has already been asked. I guess I'm just wondering how the respiratory illness season this year compares with recent ones, and also which parts of the state you're seeing the highest spikes in.
Well, obviously, we're seeing the highest number of cases in the southern region of Wisconsin and southeastern. They're the ones with the highest population, so that stands to reason why that's going to be happening. I mean, as far as the others, comparison to other seasons, it's a little early to tell. It could be that since we're seeing such a high increase, maybe it won't be a very long season. We're hoping for that. I mean, worst case scenario with the high increase we've been seeing, and it stretches out to be a very long season, that could be much more devastating, especially on the healthcare system. But it's just a little too early to tell at this point and make those comparisons, Sarah. Sorry.
And Sarah, do you have another question?
Yeah, I did want to ask too about bird flu and if you're seeing any concerning spikes in flu A that could be indicative of bird flu and how the state is preparing for the possibility of that becoming part of seasonal spread, perhaps in the future.
Yeah, we are continuing to monitor along with the Department of Agriculture, Trade and Consumer Protection and the Department of Natural Resources, any possibilities of poultry farms, dairy farms being infected. We're also monitoring the fact that there could be wild birds that have HPAI, highly pathogenic avian influenza. We've not seen any, we have seen typical spikes, based on the correspondence between our laboratory data for humans and some of our other factors that are looking into. Everything seems to be corresponding, and it seems to be seasonal influenza A that we're looking at right now. Nothing that would indicate any kind of spikes or concerns about highly pathogenic avian influenza, but we continue to work with these other agencies and to monitor healthcare workers. We are monitoring people who are exposed. We really are doing, I think, a very good job at doing the monitoring on that, but nothing that would indicate any kind of increase in incidence of highly pathogenic avian influenza.
Thank you, Sarah. We'll go back around the horn again and start with Katie Thorson from WXPR in Rhinelander. Katie, do you have another question?
I do not have another question. Thank you.
Thank you. Eric Gunn from Wisconsin Examiner.
Good, thanks.
Okay, Hope Kerwin from Wisconsin Public Radio.
I actually have another bird flu related question. I'm curious if there is any sort of kind of urgency or desire to want to see those seasonal flu shot numbers increase just to prevent the possibility of, as we see bird flu in the state, the possibility of those two types of influenzas having a chance to mix.
Yes, there's definitely a concern on that. And we do have a program to work with dairy farmers and poultry farmers to get them vaccinated. It goes through our Bureau of Environmental and Occupational Health. So they're trying to reach out and get these farmers and the workers who on the farms to get vaccinated as quickly as possible. If it becomes a co-infection with highly pathogenic avian influenza and seasonal, I mean, that could be very devastating to someone, even to someone who doesn't have high risk factors for complications. They could come down with some very severe illnesses. So we really want to make sure that they get their vaccines. We do know that their vaccine is not going to cover the H5, the highly pathogenic avian influenza. But if we can prevent one from happening, preventing the co-infections, that is one of our goals here at the Department of Health Services.
And a follow-up, Katie? I'm sorry, Hope.
That was all I had. Thank you very much.
Thank you. And Drew Best from WBAY TV in Green Bay. Drew?
All right, so just one more question, kind of as people see these numbers grow and they may be growing more concerned with the idea of wanting to get a flu shot, what would you recommend their next steps be in this process?
Well, there's several ways to find a vaccine. I mean, there's a vaccine finder on the website. Certainly calling the clinicians and getting an appointment as quickly as possible as well. But there also are some clinics that are still being run, for the public. So multiple ways of trying to locate a good place to get the vaccine. But again, like you said, we just want to encourage that people get it as soon as possible. It will help them out. It will they will not get these more severe symptoms if they've been vaccinated. And in many cases, it can definitely prevent influenza or COVID or RSV.
Any other questions, Drew?
I guess just one more about kind of how to avoid spreading these flu and respiratory viruses around a household, because obviously typically, especially if there's a family member in need, there'll be another caregiver. What's the best way to kind of go about that situation?
That's a really good question, and that's a hard one to answer too, because especially if the main caregiver is the one who's become ill, has to perhaps take care of young children, that could be very, very difficult. I mean, the caregiver, the person who is sick, can certainly do the best they can to separate as much as possible, but again, it's not going to be possible if they're dealing with younger children or older adults who need their care. They certainly can wear a mask. There's nothing to be ashamed of to wear a mask inside the house, or even if you have to go out into public for whatever reason while you're sick. We do prefer people stay home, and to give themselves a chance to heal, but there are circumstances where they're going to have to go out. Maybe pick up a prescription, pick up some food for their families. All we're asking is to use some common sense, to use good hygiene as best you can. We know nothing's 100%. But those are some of the things to really think about as to how I can avoid myself from spreading this to somebody who might be susceptible and wind up in the hospital. But you make a very good point on that.
Thank you, Drew. And we'll conclude our questions today with Sarah Volpenheim from the Journal Sentinel. Sarah?
Thanks. I think the last question I have is just a kind of technical one. I was looking at the DHS dashboards that said somewhere around 20% of emergency department visits had a respiratory illness diagnosis. And then if you added up the percentages for COVID, RSV, and flu, it was something like 5% of ED visits. So I was wondering what that remaining 15% was. What kind of respiratory illnesses were those others?
It could be many different things. I mean, one of the things we've been considering in our dashboard is pertussis involved with this. Our dashboard does not give a lot of information on pertussis. That's been given in a different from a different section who have their own particular dashboard. Mycoplasma pneumoniae. We've had a lot of cases of that, and how is that affecting the dashboard? That's the one that causes walking pneumonia, where we've had a lot of pediatric pneumonia cases, which fortunately are starting to go down, which we're very happy with. But there's just so many different viruses that could be involved. We're high at parainfluenza, which is not to be associated with influenza at all. We're also seeing much higher increases in seasonal coronaviruses. Again, not to be confused with SARS coronavirus type 2. These things happen, and they happen and they're expected at this time of year. But all of those things involved, because we don't have particular data on each and every virus, the dashboard would probably be overwhelmed and would be crashing. But those are some of the other viruses that could be playing the role, with this other 15% that you said are kind of not being identified.
Okay, great. And a quick follow-up. In terms of some of those other illnesses, are you seeing any concerning spikes in any of them that are higher than other past seasons? And what are you seeing in terms of walking pneumonia cases specifically as well?
Yeah, the walking pneumonia cases that were starting to go down this past week. We were about at 1.7% positivity rate. In normal seasons, we very rarely get over 0.5%. But over the past, I would say 2 to 3 months, we've been averaging about 5%, which is very high. But those numbers are steadily going down. We're optimistic that they're going to continue to go down as well. Was there another part of your question that I missed? I'm sorry, Sarah.
Yeah, no problem. The other part was if there's any other illnesses that you're seeing a spike in compared to past seasons.
Not really. We're looking at that very closely as well. And with the seasonal coronaviruses, with the parainfluenzas, they all seem to be what we would expect at this particular time of year. But we are keeping an eye on it to make sure that we don't have some kind of anomaly that happens all of a sudden that will make things even worse than what they could be.
Thank you. And with that, we will conclude today's media availability. Our thanks to Tom Haupt and all of you who participated. Any additional information can be found on the DHS website, or if you have a follow-up question, please feel free to contact DHS Media. Thank you for joining us and stay well.
Thank you, everybody.